But this is a time for sober realities, where speculation, where projections of things that aren't backed up necessarily by fact, where going on the internet and I heard this and I saw this is not only unhelpful, but it can be negative. It can create a climate of fear that isn't warranted. If this situation advances, we will speak clearly as a county government in every single communication that we have. We're not going to hide anything. But by the same token, we're not going to turn this into a circus, because we will do more damage to this county and this country if we do. I think it's very important for that to be as much a part of the element of the concern here as is the physical concern over the spreading of the virus.
So we want to let you know that we currently have travelers that have come back into the county from areas of the world where COVID-19 cases have occurred. These people are not ill, but we still have to monitor them. Anyone who is coming into the country, into the airports, who have been sick or are sick, showing symptoms of COVID, are being isolated by the CDC, and to date, no sick people with symptoms of COVID-19 have come into the county. The Westchester County Department of Health is currently monitoring 26 individuals. These individuals are all quarantined. This is a voluntary quarantine, most in their homes. Generally, people don't understand the difference between the terms quarantine and isolation, but isolation is a term that's used when we would keep you in an area when you are sick or showing symptoms of a disease, whereas quarantine means that you may have potentially been exposed to the disease, and so you're being removed from others. So the Westchester County Department of Health, we are following the CDC and the New York State Department of Health guidelines and protocols. We have been closely working with our Bureau of Emergency Services and our county public safety to assist. They've assisted not only us, but this 26 people that we do have currently in quarantine. The county is making sure that the individuals have everything they need to maintain their separation, their isolation within their homes. So food, medications, whatever they need, we're ensuring that they have these things. We have established a way to do video conferencing with most of the individuals using smartphones. And we are in constant communication. So they have our phone number. They can call us at any time should there be any questions or problems. Should they become ill or need to be transported, public safety and emergency services would oversee that and make sure that the right staff with trained staff the right equipment with trained staff is being used. The Department of Emergency Services has sent correspondence to all of the fire and EMS agencies with the latest guidance from the New York State Department of Health and the CDC on responding to potential novel coronavirus patients.